no yen your dream more. But mother say yam. Elinamo Kejamo. No back a Muslim ya mercy lea soli. Ni Kamoko Bear, they come back to it. Okay, what? They quack a minute, I never fake a washing machine. Then they answer. But a Sharia, a tuning you by engineer. Ni Fiki Gbajano to go naked by a Akluaneno. Nika Al-Aklu Manatu Taklifi Sharia. And the Fiki term for this is religious obligations are predicated or dependent on the mental soundness. Ake nibi ni akla aka jamo suya jamo ne obana kaka bia kachi many conditions in yele many no adomona na kachi haji femu efe oti amogo no ayo go na ba me dwemo yidan be ko me ake mo ndale to yi sani dwemo mi asa iwo gbeken na kala masjid na solio gbeken na ha le yon ma atuale naji ke seje ele shi ebela boni mi nke boke wasole ko ni amanyomo wo oloyin ake wasole ko ni gembe iwo nyomo ka se hawo and that is the validity and acceptance of any religious deed depends on the soundness and maturity of the mind. No manomia ke ni mo jalo ya Islam le no fe le ba fe aka ba kojo le aba le jomo aba wo nyomo alo ba gbele to ye idamo ejomo ke eni idale hye ngele no na susu ake ibanya konta ebu no ake ba ka ji awo ni ma chu no ye mente ko ma no mente na chi ameta ji mo ne wo gbeken ke moni ena icho hela. And that is why Islam doesn't oblige the minor and the mentally challenged to observe religious obligations. Moreover, the orphan who is a minor is put under the care of a mature person until he or she becomes of age. And signs of maturity are observed in his or her behavior. And I think Quran chapter 4 verse 5 to 6 will explain this further. One can no ba la keshin ke ake jachun telemo go akwa dwemo ye kan akonta bu na mi no e ba la ke awon sanko na gbo asin le ne e gbo asin na mo elebode ba fi le ba patan yin ni Islam to gbeji anu ake akelago mokode ni mo akro ale ka si be na ba na okadi ni chun akeshi gbege na gbe ni yin fa eyin e tire le boni kaga ni we de eyin e patan yin. And the Prophet sallallahu alaihi wasallam gave us a certain hadith regarding this. قال النبي صلى الله عليه وسلم نعمتان مغبون فيهما كثير من الناس الصحة والفراغ. Said two favors that many of the people squander are health and free time. And this can be found in Al-Tirmidhi number 3204. Hello, okay. Dromo enyo kome. Salam. Ni adesan patan yin. Ti gbomo tu wa le ne. Ka gbene de kan. Ni wona. And therefore, just as when you see something holding the jaw, you suspect that they might be probably having a toothache. Likewise, when you meet somebody eating from the dustbin, you must be told there's a problem. Boni ko kembo ko ne efu e kada. No ko tabu ba ke ba ke alo kaka ngbe na. Ko kembo ko ne tatumo ne ye ni. Sanu na ke shi na gba e ba ju e mo. Ene ka mi se ko ni mo ko e sho ni san le kan gbe no. Mo ni jo nbe jo ba mo ya fele le mo ni shi kele ko te se ba le ba gbe bo e. No one se ko wa kembo ko nkase ni e sho woni le ka shi. No fe no ni gale sake lo fi o gale ba yen fi. Wo je wan le. Na pon ni bi e ka le mo. Ana na ko be ni mo ni jo nbe jo gba fe. Ni gale fe ko. Ke o ko ni gale kan gbe te ni sake lo. Se fola. Ichon we la che. E se ke la ke chon ni ba twale en de kan. Be san le ni. Be ko me na ke ma jana gba ni ba. Ye wani fe mo ko me ni wo fe la ju gba he wo. No me jinu ba ji na. To ga la o pe. Be ko me e ko me un ba. Through no fault of ours. What fe ko no ko through ka ni ba to wo gbo. Onu o san wo pe la ka he la wo ncha. Ni ka onu shishi. Ake sen mi no san ni ka he la mu mi. Aba kaibo ake mram ni awo tu eno asiba na so you try go aye ko lo amana omo in afternoon but ma dey say so ake oh why oye oh ye efa but ni mo ba shi amele ka amelo e wo ba call ake shi fi ko no go ni ke ile ba twa mi oje be mi un ka you know be wa ta o chaba kene nka onye se ko na apolo le nyemba nche kon ko ne ko efe gole ka ve ga awo penisi on tete ka yin mi ama ga as wise old man has been saying that prevention is better than cure eyin ngwa na fu awon mi na ti be go apolo mo le ka wo yo se ni bi ni ame so mo tomo chofan poyin aye ta eni ndike ake eke dwemo hela pa sanwo yo ke chena kan ni biye no majini ba ye po wa ye na kan gbe no ka olo ebe ni ke oba pe yo le ka elina chito mon ke chon yin woni sani ele je imam sa no ni na ke wo ke no go fio no chembe da jaba o sanji ko fe gwe wa na ke ndoro bona fe bs aka kula chichon o mbia la ke no ke ne ke to mo jaba ni le no be gwe no e bale na ka e ka mo no ne sen le no ni ene mo le shu no o mbia la ka chumo we che ke to mo fe o je yin me le gbe o te na ma bo e o fe o na gba fe na gba subhana kala mo bi mdika nashhadu la ilaha illa anta nastaghfiruka wa natubu ilayk subhana rabbika rabbil izzati amma yasifun wassalamu ala al mursalin alhamdulillah rabbil
Assalamu alaikum. We thank our Imam for his short delivery. We need to, those days we say comedies before you go in for the proper film, so this is a warm-up for us. So, sister Dr. Ani Ebani Ekwaba, we will call on our doctor to come and start a chat with us. Doctor, maybe you can just introduce yourselves again and then start the show.
Sorry, I've destroyed the microphone. أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. إن الحمد لله والصلاة والسلام على رسول الله Amma ba'd. Assalamu alaikum wa rahmatullahi wa barakatuh. Mr. Chairman, thank you very much for this opportunity again. My name is Dr. Samira Majeed. I'm a specialist psychiatrist and I work at Kolebu Teaching Hospital Psychiatry Department. So again, thank you very much for giving me this opportunity to come and educate and serve as a reminder to myself and my Muslim Ummah as well. Okay. So I think Imam has said a bit about the Islamic perspective. I am no scholar. I'm still learning as well. And so as I do the talk, once in a while, I'll chip in one or two of the Islamic perspective. Okay. So I think the last time when I came, I started asking questions. Let me say a little bit of tree. Please forgive me, my tree is not that very strong. Patro Midindi, Dr. Samira Majeed. I'll go with the English. Thank you. Pardon? Okay, sure.
Yele ake ga ke tree no ke ni we bana tree nga.
So the last time I started by asking what we knew about mental health, and I think I got a number of us to tell us a bit about it, so I won't go deep again. Maybe subsequently when I'm going through, I'll ask one or two questions and see. So the last time we mentioned that mental health is a state of well-being, okay, that enables us to cope with the daily stresses of life. We being able to realize our abilities as humans, we being able to learn and work and also contribute meaningfully to the community. And so if there is anything that is affecting any of this, it could serve as or pose as a risk to our mental health, or the fact that it could be that your mental health is at stake. And so if you are there and you cannot cope with the stresses of life, you are there and you cannot realize your abilities, you cannot learn well, you cannot work well, probably there's something that is really affecting your mental health. And it's very important that we know this, and as time goes on, we get to understand why there is a need for us to know about mental health.
Well, Doctor we ake boma de sa jomo mshikamo ke bomo shomi kamo hia wa denche. Ni bi baba o ha ni be pie wo jomo shikamo ke bomo cho be me wo na susumo e pome ni ha ni wonye wo fe wo ni bi ojogba wo mene wo ba ka se ni bi ekomi ni ha ni keji na ka ni bi ba osusumo mi o le bo no ba fe ko ni ona to enjoy.
So normally it's very common that we go to the hospital because we are having headache, we are having stomach pain and all that, and we ignore our mental health. But I have to let you know that if you want a holistic health, then both your physical and your mental health has to be good. Now, mental health affects the way we think. So one thing we should know is that whatever we are feeding our minds, whatever we are thinking constantly, okay, maybe social media, we are watching certain things, we are listening to certain things, whatever you are thinking about, gradually it tends to push into what you kind of feel. So you start thinking, then you start feeling, then subsequently you start behaving that way. Okay, so let's give example. You are somebody who normally watches these, okay, let's say for our Muslim ladies, maybe particular dressing, the hijabs, they don't really do hijab, they just cover their head. Constantly are watching it and watching these styles and all that. Subsequently, you start feeling that, maybe let me try wearing this thing. but you probably forget what the standards of our hijab. Just because you've always been watching it and thinking about it, you start to feel that maybe if I start wearing this thing, I'll feel a bit better, or I'll look nice like how everybody thinks, or everybody thinks. So what happens is that after you've started thinking, right now you are feeling that way. What happens is that it translates into your behavior. So now you actually go get the particular dress or the way they are doing it, and now you start practicing. You are behaving that way. That's just an example, actually, I'm giving. Yes, so we have to know that these things affect us, and that is why we are actually talking about it. So it's an integral part of health and well-being, and it affects everybody, be it child, be it adults, be it elderly. Everybody is affected by mental health, and so that is why we need to know. If your mental health, you don't have a good mental health, it will affect you personally, it will affect your community, and at the long end, it would affect your the country as well. So it's very important that we know that.
Well, Doctor, you are catching example. They had a colleague, Kaji Oinchong Babu. Ofula Kashi into a Babu Kake. She Yake Asanono ya Hilachamo here, na be Ukwanoni Fiob. They have example like she Bekome Obana ni waye ka ye for example. Ekule as a Muslim asanu owo atale ni saake Muslim asanu o hijab ke no fa no fa. She Bekome wana no won kwa TV ke ni bi kuma wobo ni bi kuma tuwe. Ojomo beno okwa na kan ni bi ojomo okwa bo ake show amu ma ya na kan be. Alo ma fe na kan noko because jomo be a good health. Ni bomo chwa be good health ehani beno ba na okwa wa ke Bekome anma ama kama kwe woko cash komeno kwe obana no ni chon osu koba bodo na no obute na kan ni emi e ke ye no example ni wo fe wole ke hie fe be kome ni bi ekome at least so kwe soap opera ke ni bi ekome okwa hu eno na ke o ni ekome e ba bute o nchum alo ba na ni le ake o na hia mi shi islamically ekole hi ni e ba gba ojomo cho na ke jomo le wana keke ohie da jalo ye ojomo e cash ake obe igbomocho wala lo ncho egbe igbomocho wala ojugba now.
Let me put in a little bit of an Islamic perspective here. So alhamdulillah, we are Muslims, and to have this holistic health I'm talking about, and for that matter mental health specifically, we are guided by principle of Islam. And so if we even want to get the good physical and mental health, then we following the principles of Allah is the way out, because in the Quran, the Hadiths, the Sunnah, Allah has taught us ways of means of coping, things you should do that will safeguard our health, things that we do that will safeguard our mental health. And so if we ponder on the Quran and the Sunnah, the Sirah, we do it the way we are supposed to do, it serves as a kind of protection against some of these things. And even if we are to develop it, there are ways that the Quran has taught us that we should go through that would help, including seeking help in the health facility. And so we know that the Deen al-Islam is a way of life, right? It affects the way we feel, it affects our thoughts, and it also affects our behavior. So you can see that it's almost likening to the explanation I gave about mental health. And so if we want that holistic health, we already have what it's there to actually help us realize it. And the Quran has made it very clearly, okay? The fact that the Holy Book is a guidance to us, okay? And it teaches us what to do and what not to do, as well as following the Prophet, peace be upon him. I mean, Surah Al-Azab, Ayah 21 states that there has certainly been for you in the Messenger of Allah an excellent pattern for anyone whose hope is in Allah in the last day and who remembers Allah often. I'm sure, and you would have heard that in order to actually have this mental health, zikr is one thing that we shouldn't leave for granted. as time goes on, I'll come and delve deeper into that a bit.
Okay, well, Doctor and you actually, ake bomade sa. You want for Muslim, like when we are about Muslims, okay? Ake what for Muslim, Quran, balo you mo, lojino ni kaji wakwe. Alo wake chuni, ebanu wakomochu efe, ake mental health, wakomochu efe, anatu enjole. Ni wa imams weke wada na ke kaji wa here Quran, ke hadith, wake mimla chuni, loji tu enjole ni bomade sa se Muslim wana. De yu ake balo Muhammad ya Quran numodenche eyu nwa ke shi balo Muhammad sallallahu alaihi wasallam. Esu ke ba kaji wakase ni wakefe wade here mochu obana tu enjole. De yu about dhikri. Na gbene hunu wa kai nungbo. Pitio ya waje shidem. Kaji wo kai nungbo pitio ya oje shidem. Mental health ake ye gomocho e wale na mo mi obana gomocho e wale obana tu enjole ye oje shidem.
So, why is it important that we talk about mental health? I'm sure we are all thinking that the people who are only affected by mental health is those that we see on the road, and that's actually a lie. You'd be surprised that even amongst us, there are some people that are struggling with this mental health issue, but they do not even know that that is actually a mental health problem. And so it's said that 1 out of 8 people, so when I take maybe 1, 2, 3, 4, 5, 6, 7, 8, at least would have one person who has a mental health problem. And so it's very important that we talk about this and we actually know. And let's not think that mental health only, like I said, affects only adults. Even adolescents, children, they also are affected by this issue. And as of 2021, they say 31% or 10% of our population, that's here in Ghana, has mental health problems. So at that time, we had 31 million people in Ghana. So it meant that 3.1 million of that 31 people had issues with mental health problem. And that is why it's important that we talk about it. Now, there was a study that was done in the Muslim community. And then what they realized was that, okay, not the Muslim community, but in the community, and they found out that most of these mental health problems, the first point of call is that we take it to our faith-based healers and traditionalists. Already, West African countries or even Ghana, we are more spiritual beings, and so everything we see or everything that we believe that has a mental health issue, the first point of call is to take to our imams or our religious based healers, and not the hospital settings. We are actually making or talking about this mental health issue so that we know that, yes, aside taking these issues to imams, the mosques, and then other faith-based, it's very important that it's sent to the hospital facility where care can be given to such individuals as well.
Well, doctor, we actually ake jomomi hewale namo. Alono jomomi ba fibu ibana hewale enyane wa denche. Dilele wanile lo eke as Muslims say. Kewo jomomi kan ojogba lo ye gbomocho hewale. Gbomocho efe ba na hewale. That is one layer. No, we actually ke akanime 8. No, ke won kanime 8. Ke won kanike just say 1, 2, 3, 4, 5, 6, 7, 8. Mukome mi ni kole ejobo e ka should go age igbe gbomojo wale. Shiti ameni. Ele ke won ke fi example. No, e ke wo bomode ko ni wo ko na kan je. Agbene ke ba ke afi study ko. Study ni afeji study e jo ankeshi ake bama de sai normally keji noku ake jomo noku ngba jomo na iwale na gbefa osmo ni wo benke religious wo sofu ke wo imams ke ni be ni wo ke sane agba me hi ko ni ameha wo wi mo ke chomo shi ewo wo ngakeshi wo bomode ni keji na ka noku ngba wo na wo ya hospital koni wa bo meni atwame ni le na kan ni egbefa koni wo ka mana sande gba ye no ni gba wo na koni amehu amewo wo ga further.
So I want to throw a question today that why do we think that, for example, we Muslims or even others, maybe Christians or all that, do not take issues of mental health to the hospital, but their first point of call is maybe the mosques or the church? Why do we think so?
Eke ibabi was saneles monu answer. Eke ma ba keji or Muslims alo ke lokun bawo na was small ni waya hospital she was money work or imam fue ke osofo fue agbasane. We bisandi wo asani mo ko answer. Ko won ni no kenke Mike ba wa bo ejeni.
Assalamu alaikum. I think it's because we have the notion that these conditions are more of spiritual. It has a spiritual aspect than a physical aspect that's going to the hospital and stuff.
Thank you.
Yes. Mugoke ne answer obra ke baby wo feel like she ene mumo nibi no was one wo benke wo imam fu ko software ni wona ka sane wo ya hospital ni wa bi yesa.
Assalamu alaikum. Like my brother said, most people believe that mental health, for that matter, madness, is caused by the jinn. So sometimes when this happens, they take it to Iraqi. Iraqi is somebody who performs ruqya to recite Quran for the person to be healed.
Yes.
Yeah.
Assalamu alaikum. Please, I also think that we believe that whatever happens is the degree of Allah. So everything that happens, we go to the Imam so that whatever is related to it, according to the Quran, we are being taught.
Okay. Thank you very much.
Let me go here. There's someone. Okay.
Salaam alaikum.
Malik.
Ofa ron ma yu eji mu eko efe mi da ibi ane ya mental hospital lolu ka ya 2 3 ni bon ya first ka ken ya ma ken ya ken brother say ma me wo bi o ken ni bi ni ken ya aga ba mi spiritual mo me feel spiritual bi ni po aba mi ba ke talk about mind you are feeling still if bi ane ya si bi ane ka chofan ta ya feel ti mo ni ma wo esa ka chofan ta ni ma wo ke
Okay, well, we know he's saying that for him, he had experienced it before. He had a mental health problem, and they took him to this ruqya prayers and everything, but couldn't happen. But now he goes to the hospital, and he's been given medicines and everything to cure himself.
Alhamdulillah. We thank Allah that he's doing far better now.
Salamu alaikum.
Wa alaikum salam.
People also think someone is them. So
Yes.
they want to know whether it's true someone is attacking them.
Okay. Thank you all very much for your
But
question.
all of them are spoken, but they left one thing. No. The one thing is the money. The money too is a
money.
factor too. Yes. So
Okay.
let's go on.
Okay. Thank you all very much for the answers. And yes, all the concerns that you raise are, yes, genuine reasons why some individuals do not go to the hospital setting. One other thing, aside all that you've mentioned, is that people don't even know that what I am actually going through is actually a mental health problem. And so they do not even know that, yes, those problems that they are having can be helped when they go to the hospital setting. And yes, all the answers that you gave were actually right, because there was a study that was done in a Muslim community, but not in Africa, in the Western world. And the reasons why people were not going, number one, was because they did not know that whatever symptoms they were having were psychiatric problems. And number two, also, I think that was mentioned clearly, the ruqya or the spiritual basis that we always ascribe to mental health issues as Muslims. And then, more importantly, the lack of awareness that about the integration of Islamic values into the hospital management modalities. And we'll get to know, or I'll explain to you why there's this integration. And so some people think that even if I take my relative to the hospital, it's against my religion to even actually take the person to the hospital, because what is not, like you said, is because of the spiritual aspects that they are thinking of. Why should they actually even take this person to the hospital?
Okay, anukwale ji nanu wa wi fe itoni ye ha na kan ni sheke be pie wote me pie ne ke mental wellness wole no ni ji no keji ba ne ke wole bo no ba fe ne no na agba aha wo ne wi akeshi ake hospitals no wo here ake bo muslims bo ni wo yo wo ni abanya ni ake Islam nile awo hospital ni fe mo jiyan mi ko ni ke buku baje abanya ni in that aspect of women akele ba yu alo chaba na ba le ni ba wa le ke ni bi me hospitals jiyan abena kan gbeja no to eje no ha ni be pi keji wo na agba ye wo jomo mi if you ake was mon wo ba ya hospital like ni bi.
Another question. I want it to be interactive so that nobody is actually sleeping or yawning. So my next question.
When I see somebody sleeping, I'll give the mic to the person.
So my question is that what do we think causes these mental health problems? Any ideas?
Okay, mini hani BP jomo iwale namo ona miniji BP ni bi ekomi.
Sometimes lifestyle can also be part of it, and then stresses that you go through. For instance, somebody have completed his education, seeking for job for so many years, and is not getting frustration and other things setting.
Yes. We are doing very well. That means,
Assalamu alaikum.
wa alaikum
Of
salam.
our call you know feel like my feeling, over much, over tune, over feeling, over when I can be a piano, or to only be pure call your potential. But you may relax, then or to any BP, I can be a favor.
Saying that we sometimes we think of doing a lot of things. I want to build this. I want to buy this car. I want to do those things, all those things. Then once you are not able to do it, it also has an effect on you.
Yes, very true. These are daily things that we all go through. Nobody is immune actually. But then we'll go through things that you can do that can help yourself.
Assalamu alaikum.
Wa alaikum salam.
Sometimes it also has to do with substance abuse.
Okay.
Yeah.
Thank you.
Yeah, okay. Yes.
Thank you.
Fane salam alaikum.
Wa alaikum salam.
O fane ye bi nunko ni eke fataloye. Nle no de ba eke ibanje. Wo de ba eke ya no chumoni ale shikani ke. Shi je no ni driver nu etwa. E o mbile bata steroids eni de nkopo. Ni ke o mi neba. Shi e ba e shika ye ndi ni kete no chumo. Shi do ko no ko efi. E o bile e popo. Wọ́n fẹ́ ń change ẹ̀mọ̀ fún níbílẹ̀ bá níbílẹ̀ kẹ̀kẹ́ ò máa ń yẹ popo ń yẹ ìwalẹ̀ ṣímí náà kẹ́ ní ẹ̀mí popo ṣímí náà kẹ́ bẹ́ẹ̀ kẹ́ ń hàn problem ẹ wò èéjú ẹ̀mọ̀ mi ní ẹ balẹ̀ nàkàn ẹ̀ ló agbẹnẹyẹ bí yóò bí okun ẹ náà 18 years lẹ́hún nkẹlẹ́mí jùmọ̀ lẹ̀ tó mọ̀ 3 years time mi ní èjú ẹ̀mọ̀ wọn bá ṣàlẹ̀ nkẹlẹ́ tẹ hospital lẹ́hún. Hiemi, Kenya aba osidi akemeno. Ni aba osa agbene ni ebahin. Ihe ochofun e kome 1 million. Ya hun 8. Inye ma edon. Ni wonkele ya akolibu edon. Ewo be taflache. Njie ni din. Tekle na ke han minye. Ni bache ko ni kaba fimole. Kejendo se eba kodon. Shi dwemo bele pepepe. Eta shin. E foshin. Ewo pi le hunenye
what time I was shaving, I can go in, what you know, please. What our sister is saying is, she has a son who has a wife, and then there was a problem in the house. So the son came to her and demanded for money to go to work. So when the son got the money, went to work, he was sitting on behind the steering, and the hand was shaking. So she thought that maybe it's because of the problem he's having with the wife at home. So it's also having a mental problem. And then she also said about she has a daughter, 8 years and 18, and something happened to her, and she took her to the hospital, and things were not going very well for her. So she brought the daughter home, and then in Ghana we have something. If a woman is out of the husband is dead and he stays for a certain while, when they remove the dress, normally we wear black. Some of them wear black. So after that, then they give you something to put somewhere. So she removed her own and then tied it on the daughter. But everything came all right, nicely for the child. But still, some effects were showing. So he also disturbed her as well. So that is the whole thing. Let me take one person raises her hand. If I don't give it to her, it will be a problem.
Please, substance use like alcohol and drug abuse.
Okay, thank you very much.
It's loneliness.
Loneliness. Okay.
Nobody wants to hear you. Affect the brain.
Can predispose. Okay. So thank you all very much for your intelligent answers. I think as for Asia at the back, probably maybe later on we can have a conversation. And then we see if the relative really needs an attention, then we direct accordingly. Okay. So yes. So one thing we have to know is that for you to develop mental health issues, there are a lot of factors that will play a role, will come together to push you to develop a mental health problem. And I'll put it into some categories, okay? So we have the social, economic, political, and environmental factors. So for instance, poverty, I think, is one major drive. You know, having money, like our brother said, constant thinking about wanting to do certain things from yourself, not realizing those goals, seeing yourself as a loser, looking down on yourself, low self-esteem. That's how it gradually builds up, okay? Together with other factors, it all comes and push you to developing the mental health issue. So other things like violence. So Gaza, we see the bombings here and there. We pray that may Allah forgive them and help them in these needs. What happens is that at every point in time, these people are anxious because you don't know where the bomb would land. And you don't know if you'll be there. So you are always what? Anxious. You are scared. You see, people are always hiding. There is food shortage. Okay? Not only Gaza, but places where there is war. Okay, it pushes you to developing mental health problems, losing people through the war, your loved ones. And I'm sure most of us may have gone through that stage in life where you've lost somebody who was very close to you. And how did you feel? You felt so numb, okay? And if there wasn't support or anything to help you, it can actually push you to develop a mental health problem. And that is why I'm saying that all of us are at risk, because wherever we are, life happens at certain times. We undergo certain stresses of life it's not as though you are doing it, but it just happens and you cannot do anything about it. But what can you do to help yourself in those times is what is very important, and we'll talk about it later. Another thing is disease outbreak. When we had the COVID, how did we feel? I mean, you didn't want to go out, right? You didn't go and you didn't want to even hold somebody. If somebody do it, hey, the person will even finish the 18. You would have moved away from the person long time ago. Okay, you won't want to go to the market anywhere because you are scared that, hey, if I go COVID-19, I will get some. The anxiety of the illness. People lost their works because of that. All these things would have a factor. Then I talk about the biological stuff. I think the last time I mentioned to you, just like hypertension, if you have a family member who has a mental health problem, you in the family have a higher risk of developing that mental health problem than somebody who does not have it in the family. And I went on to say that it doesn't mean that if there is nobody in your family that has a mental health problem, it doesn't mean that you are immune or you cannot get mental health problem. You can. But then the risk is a little bit high if there is somebody in your family that has the condition. Just like hypertension, if your mother, your father, or your auntie, or anyone in the family has hypertension, you are also at higher risk of having hypertension. So they tell you that you should be checking your BPs regularly. It's the same thing with mental health. If somebody in your family has mental health issue, you also have to be checking yourself once in a while. Okay, and you also have to put in certain things to protect yourself from developing these conditions.
Well, doctor, you are catching me anywhere. No, you are a robber modern, a carol brand, and you are a poverty here, be poor honey, or John Babao, called John Babao, a board, and they are going to react as Yabene, countries come in Yano, Tania, no, be Pierre Kaji, be Agbiam and Papa make Agbiam and India, be Penu Barman, she, Jen Becker Hunter, she carry a power, she let go Hilahu. Ekole family mi ayemokoni ekole hilaji ekome wo bebi ka onu hila echawa bona afiole ke nibi alobo na egba amona be ko ke bo tase osusu ona kan ya ga animi hu de ani ye na kan hila ekolo no wi ake wo bomode ake hila chamo he wo ya je ni be pie wo bi ke nibi ko be ngba wona wo ya ko ni aha woni le ye.
Another thing is that there are some things that, like I said, would happen to us. For example, we women, pregnancy. Pregnancy in itself is a stressful condition. I mean, it's not an illness, but then there are somewhat hormonal changes that occur during that period that can push you to developing these mental health problems. Again, some early childhood experiences like bullying, okay, in schools where children are picking up on other children, insulting other children who may have a little bit of maybe deformities or anything. Okay, bullying should be discouraged in school because it can push these children to developing mental health. Every time your child comes to school and the other school children are teasing the child, it's always insulting the child or belittling the child. What happens is that with time, these children develop some form of inferiority complex. They see themselves as not, worthy and all that, and all these things can lead to mental health issue. And so for our teachers who are amongst us here, and our mothers and our fathers, let's not discourage bullying, because it's one thing that is really affecting our children a lot. Another thing is sexual abuse. So for children who are growing up, both male and females, please, let's all of us have an eye on these children, okay? If a child is coming and starts talking about sexual things to you, don't see it as akwalabonism, okay? You have to probe further and get to know, because sometimes these children are being abused, okay, and are being forced not to talk about it. So please, let's be very vigilant, and not only the women, the girl child, the boy child too. Okay, abuses, it go both hands, and so it's very important. Like I said, children to develop mental health problem, and when it starts young like that, and these issues are not resolved, they grow up, and I mean, they can develop other mental health issues like depression, anxiety, and at a point they even feel like life is not worth it again. Okay, let me end it, which is very serious.
Okay, well, Doctor Yuakeshi, we have a equally example, Jack, when you Kaji Ekula, when you musu, but only be Babao me. I get more to only be Babao me. Like Jemo Juba, Unana by ye Umusu Yemomi, Nibikuma, Ekule, Uwasane Abushkano Hospital, Hakubu, ni Echonha, Mokenibu, and Agbawa, no, baby. Wọ́n mọ̀ dín kẹ́ ìbànú kan wọ́n bẹ́ǹkẹ̀ ìlà chámọ̀ hìẹ́ àná wọ́n bẹ́ǹkẹ̀ bùkún ní àtúnlẹ̀ ní ìyẹnà kan níbí àhè kó ní ìkẹ̀bọ̀ àná yóò ní ìwé about bullying yẹ̀gàn ní ẹ̀ta àkọ́tẹ̀ bullying o bullying mọ̀kó oyè mọ̀kó náà àná òfé òhán ní òfé níbi ìkùmẹ̀ nímọ̀ àfẹ́ níbi ìsà lọ́wọ́ ìkẹ́ ẹ̀nù wọ́pẹ̀ wọ́n ká fẹ́ mọ̀kó ní èfé nàgbà ìkẹ̀ hàn bí kẹ̀ ní ìwé about bí kẹ̀ bí ihu. In terms of sex, befa gẹ́gẹ́ kẹ́ bàṣà ni kò bá wé nàkà níbi ẹ̀hìn àsànúgbà ahìhì ló fèsù àkọ́ ọba check àló fèsù ọ̀kẹ́lẹ́ ànàsàndẹ̀gbà ẹ̀ nàkà níbi ẹ̀hìn kò ní kẹ́ ò nàkẹ́ èso nàkà ìmọ̀kọ ẹ̀ ọba nàkẹ́ bẹ́ àsànú ó ta ó kọ́ nínú ọba àfi ní bẹ́kẹ́ hùn àná nílé ẹ̀ nàkà níbi ẹ̀ example ní wàhánà àjẹ school ẹ̀kọ́ ní ọ̀kẹ́mọ̀kọ àgbàsàní ẹ̀ bẹ́kẹ́ ní 15 good years. 15 ekenu na bole ni ne tashi le po akeshi eyin ho alo yin ho ni form 3 wa ge na agbani was ko the parents say ngbe be nu ala me ko ele lo le we feel like yes anu ma fe ni be ni no doctor antwa akeshi ni bi e fe le ji ole po e fe be kumeke ibawo je nsile ni akegbo ma de san wo bomo ni water hini Obana naka chaba na balo aba hawo nile konu wojo mo afi wo fa.
Okay, I think we mentioned about unhealthy lifestyle and habits like drinking alcohol, gambling, which will come into a bit of details as we go on. And then also some stressful life activity like having road traffic accidents and maybe getting your hands amputated or losing some abilities that before you had. So let's say maybe before you can see very well and then all of a sudden you have an accident and then maybe you become blind. This is a major stressor which can push you to develop a mental health issue. Now another thing that we shouldn't take for granted is our physical health as well, because some of the medical conditions can push you to developing mental health problems. My elder mothers, my fathers here, my sisters and my brothers, if you have any medical condition and you've been diagnosed and you need to be on medications, please, let's make sure that we are taking good care of ourselves. So let's say you have hypertension, you have diabetes, okay? Make sure that you are taking your medication. Make sure that you are going for your monthly checkups, okay? And you are taking good care of yourself, what you are eating, whether you are exercising or not. All these things are very important because number one, if you are not taking good care of yourself, these things can push you to having stroke, okay, some renal problems and all those things. All of that can predispose you to getting some of these mental health problems that I will explain as we go on. Now, we are going to talk about identifying some common symptoms.
Before you go on, ake gboma de san wo bomo de wo ko e ko le ke diabetes ake gbomo to ni hiwale na mo ke jomo mi wa diabetes like hypertension the hila kumenu wo fe wole ate naturally gba wo na wo bomo de nkeji na kan ni bi en gba wo na aha wo ko tufa ni wo ko wo bomo de be na aha wa ke wo ko tufa je wo ye no pepepe kebi na ka ọba for check up ebe ọmọdé ló ya ló wa bùtò kága kẹsọ rẹ dé na agba ni bẹ́ẹ̀ ni nǹkan tó fa na agba bẹ́ẹ̀ ni wọ́n kẹ́ wọ́n bọ́mọdé ni wọ́n yẹ nàka ẹni bí ẹ̀ náà lẹ́kẹ́ ẹ̀ náà fẹ́ ẹ̀ fi fa ẹ̀ hà wọ̀.
Okay.
Around a brief, no, I know.
Okay. I think because of time, I made so that there will be time for people to ask questions that are bothering them. So, I think I mentioned that the way we think, if you have a mental health problem, it could affect the way you think, it could affect the way you feel, and it could also affect the way you behave. And one very important thing is that we have to know ourselves so that if you are going off board, you know that this is not how I was. Or even our mothers, our fathers, and then brothers and sisters, if you notice that maybe this is how this person is in the family, and all of a sudden something changes about the person, yes, it will give you a hint that probably there is a problem. And so now let's look at some of these changes that we should be looking out for, okay? Or if anybody is developing it, it should push you towards assessing help for the person. So we talk about thought changes. So problems with concentration, not being able to remember things, okay? And then normally what happens is that let me give an example. Sometimes for we Muslims, okay, you have this continuous feeling that probably you haven't, you have an incomplete ablution. You are thinking, you go, you perform ablution, you come back, okay, and I didn't wash my face, or my hand, and those are faraid. You have to perform, you have to, for your ablution to be complete, right? So then you go back and you go and start performing ablution again. Then you go, you are standing on the prayer mat. I don't think I performed this ablution very well. Then you go back. See this consistent, repetitive thoughts that you are unclean, you have to. Once in a while it happens. Now these things that I'm talking about, it's not like it happened to you once, then it's a problem. It should have been going on for a while. And it should have been such that it is affecting you in your daily activities or affecting your work or anything of that sort. So you are constantly having that feeling that you are unclean, or you continuously feeling of urine or any discharge making your dress unclean. So you have to go and change, you can't perform ablution. You are still, your thoughts, it's still telling you that. Not only that, sometimes we have this recurrent thoughts, okay, that maybe this place is not clean or our hands is not clean. You go, you wash, you come, you keep on thinking again, you go, you wash. All these things, we call it obsessive compulsive disorder, OCD. And it's very important that if you have it, all these conditions that I'm going to be mentioning to you can be helped in the hospital settings when you come. Also, for our elderly mothers, okay, some of them may become, or fathers, they become forgetful, okay, they can't remember people. Aging with time, sometimes these things happen, okay, but if it's very severe that they cannot recognize people that are close to them, they are forgetful to the extent they don't know wherever they put their things, they cannot go out alone. When they go, they'll get missing, and then they start exhibiting some other symptoms like shouting, excessive crying for no reason and all that. All these things, what we call dementia, okay. In the hospital settings, you can be helped as well. Another thing that we should look at is mood changes, okay. If there are rapid or dramatic shifts in your emotions, you are always depressed. Yeah, once in a while life happens and we are not happy, we are sad. But is it such that every time, most of the days, okay, most of the times in the days you are feeling sad, mostly always throughout the whole week? Maybe I'll even say 5 or 6 out of the whole week, you are not happy. Even if you hear of good news, it doesn't make you happy, okay, to the extent that things that you love doing, you are not doing it again. You don't have energy, you don't want to do anything, you are not eating, you are not sleeping. You feel that there is no hope. You start feeling as though you are worthless. Then you start having thoughts that you should harm yourself. Okay. Also, feeling of intense fear. Okay, where you start having palpitation, you feel as though something bad is going to happen to you. Okay, all these are signs. And mind you, all these things that I'm talking about, we can have it in what? Pregnant women. We can have it in what? In children as adolescents as well. Okay. The obvious one that we will see and we know that, yeah, this person has a mental illness is the broad things. You see somebody who is dirty, walking around, talking to themselves, okay, doing their hands as though they are talking to someone when nobody. As for that one, dear, even a child can diagnose that the person has a mental health issue. However, these other ones that I'm talking about, if the person doesn't come and tell you, you won't know that they have mental health issues. Another very important thing is our sleep and our feeding. Okay, if you are someone who was eating well, you are sleeping, well, all of a sudden you're not sleeping too well. Okay, you've lost appetite. Mind you, some physical or medical conditions can make you present like that. Maybe it's just that you are having maybe a typhoid, malaria. No, but if these things are persisting for months, together with some of these symptoms that I have already mentioned, okay, it's very important. And know that before we can say you have a mental health issue, okay, it should be affecting your daily functioning. So for a student, the person is not going to school, the person cannot concentrate in school. Somebody who was getting A's, now the person is getting D's, and you don't understand why the child or whoever you are, maybe a young adult in school, they're having all these challenges. It could be some of the symptoms pointing to that there's something that is wrong. Maybe you need an assessment. Okay. And then also at work, you are not able to function well. You are absenteeism. You are not going to work. Or even when you are even at work, you are not, there isn't much you are doing. You are just present there, but the productivity level is very low. Okay. And then difficulty in maintaining relationship, whether at work, at home. If you are somebody who is a very lovely person, is always fine with everybody, conversing, all of a sudden you see that this colleague, this is somebody, if you come to work, is the first person who come and greet you, ask you and all that. All of a sudden you see that your colleague is just alone, sitting at one corner, not really talking to you or interacting like before. Like I said, we know the normal or the usual. So if there is any drastic change from the usual, then there is a cause for alarm. We have to help each other. And then substance abuse, using alcohol, tramadol, red. Now I think that is the yes, unim red, it's very, and it's something that is affecting us. If you have a substance disorder, okay, it's no more is the person's willpower. Okay, initially they'll start by maybe experimenting. Okay, maybe you say in collaboration, so you start using it. I mean, they tell you not to use it, you are still using just to have the feeling. It gets to a point where you cannot control yourself. Now it is not about morals again. Now it has affected your brain to the extent that it has reset the brain, so that if you are not having the substance, you have withdrawal. So the shaking, the abdominal pain, sweating, and all that. Sometimes you have to steal to get money to go because of the way you feel if you don't get the substance. So now it's not this person doesn't have willpower, that is why the person is, no, it's now a disease and the person needs help. The same thing goes to gambling. And I think I mentioned the last time that nowadays, even a colleague or wherever you are working, there are slot machines and the children are playing with it. Okay, we think it is just a game, and so they take the coins, but gradually they are learning, and they go and stand in the bet houses and they are watching what the elders are doing, right? It's just a matter of time before they follow suit. So our mothers, our fathers, our brothers and sisters, please, let's help our young ones and let's help ourselves as well. Now let's talk about some of the symptoms in children. So convulsion, estro, okay, it's very important. Even though it's not only psychiatrists that treat convulsion, even the general practitioner, neurologist can treat convulsion. It's very important. So estro eka akolana wamfanankwa ayaresabia ehadring denti because it's going to affect the brain of the child. Remember, anytime the child has that convulsion, what happens is that the blood is not going to the brain. Okay, so what happens is that the child is not getting what the food nutrients for the brain. The child is not getting it. The brain is not getting it, right? Yes, and these things can push the child to developing other mental health issues. Okay, to the extent that I know that there are some children that can't do anything for themselves. Mothers, fathers have to care for such children. Also, if you have a child, notice that normally, maybe by some few months to, neck control, but I think 2 weeks going, the child should have had neck control, right? Okay. Sitting, specific ages, maybe walking 1 year, 1 year and a half, a child has already walked, right? And some people even walk earlier than the 1 year, sometimes the females, okay, they're talking as well. Now, if you notice that your child is not gaining those developmental milestones, then you have to recheck again. There may be issues that you do not know. So your child is 1 year, is not even able to say mama, dada. It's not able to say certain one words and all that. Please, let's be concerned, okay? Because our mothers, we know at what age our children are supposed to have walked, sit down, potty trained and all those things. If the child is finding it difficult to develop these milestones, then we need a checkup for these children. Yes, mostly we'll take them to pediatrician. Yes, that is it. But then if they develop certain things that we are the ones that are going to treat, they'll refer to us to treat accordingly. Then for some children, they cannot sit down at one place. Yes, children cannot sit at one place. But if it is very severe, child is running around, climbing everything, fidgety, okay, leave seats, not only at home, but even at school. They are telling you that this child cannot, it's always disruptive. If they're having lessons, this child will not sit down, is always running, climbing, is not paying attention in class. Impulsiveness, talking excessively, okay, adolescents, maybe are in class, or they are going to buy things, they cannot wait till they are 10, okay? They interrupt others when others are talking. They always want you to listen to their bits. And then also, for some children, you would have bought like shoes 100 times before they even finish, okay? Every time you are changing socks, because they go to school and they don't bring one shoe. I say for children, yes, it happens, but if it's becoming too much, okay, and also with poor attention span, they are not able to really copy. For these activities I'm talking about, it is age specific, okay, and then you would have noticed it's not only in your house but in multiple settings. Maybe when you come to the masjid, all these things that I'm talking about, the child is exhibiting it. You go to school, the same thing. At home, the same thing, okay, such that sometimes these children, they are head banging, they are using their head to hit the wall several times, okay. You see that they have bruises and cuts everywhere. Some of them, their pain threshold is very, very high, so they get all these wounds and all that. Another thing is that for a child, you know that a child is a social being, so it's always playing with others and all that, okay, and it's communicating with others. If you notice that your child always wants to be on their own, okay, it's children are playing, you won't go and play with them. It's always alone, okay, and they like to play with a particular toy, they like to do things in a particular way and all that. It's very important that you let us check this child. Also, the child doesn't communicate, have issues with communication. Like I said, maybe this child hasn't really developed that much speech and all that. The child needs to be assessed. And then very importantly too, if you have a child, okay, or an adolescent who is cruel to animals or humans, is stealing, okay, It's destroying property. It's always burning things. It's always running away from school. We classify those things as nkolaponism, right? Yes, sometimes, yes, they need help. Okay. And maybe sometimes the environment that they find themselves may be fueling some of these behaviors. Okay. And sometimes they may be doing this maybe in form of a defense or so, but it's a disorder. They may be doing this for no apparent reason. So it's very important that if you are noticing all these things about our children, you can have your child checked if you are thinking that there's something wrong. If you come and your child is fine, we examine the child and we think that, oh, the child is fine, we'll let you know that, oh, this is just being a child. There's nothing much to it. But then if there is a need for help, then we give you the help that is needed. Now, I wanted us to go through just a few of the myths and misconceptions about mental health. I think our time is really going very fast. That only some people have mental health problems, or it's just a few people that will develop mental health. And it's a myth, it's a misconception. Anybody can develop mental health. Probably you don't have the risk factor, so you don't have it now, but it doesn't mean that even from here you can't develop mental health problem. You can. If all these risk factors that I mentioned, you come to it, you can develop mental health problem. And then there's also this myth that people who experience mental health issue tend to be violent and dangerous. Yes. So if you have mental health problem, you are blow man. You're always beating people. It's not true. Okay. Maybe what we are, and even for the lay person or the mentally ill person walking around, have anybody seen that they are going around beating people? Has anybody seen that? Unless you provoke them, not so. So those who are walking naked on the road, or if you are passing by them, do they do their hands like they're coming to hit you or beat you? No, it's a lie. That's misconception. We have to remove it. Actually, what it is that even mental health, people who have mental health are even at higher risk of being victims of violence. Okay, so we have to remove that from our mind. And then also, we think that if you have mental health issues, it's a sign of weakness. Not at all. Like I said, maybe you don't have those risk factors now, so you don't have the mental health illness. Doesn't mean that whoever has it is weak. Okay? Probably because of the risk factors that this person find themselves, okay, they develop these issues. And so, we shouldn't call anybody who has mental issues as being weak. Now, where do we seek help? Okay. Mostly, we will tell our families, we will tell our friends or religious leaders. Okay. But it's also very important that we seek help from the hospital setting. Mind you, when you come to the hospital, it's not only medicine that will give you. Some people may not need medicine. All they need is talk therapy. Okay. And then aligning their behavior. Okay. So it's not always that when you come that we give you medicine. Sometimes we may let you go and see the clinical psychologist who would help you through therapy. Okay, things you can do that can help you in this situation. We have the addiction team. If you have addiction problems, occupational therapists who will help you if you're having work issues. Okay, so it's a whole group that come together to help you. Also, aside coming to the hospital, we need social support. It's very important. Quran chapter 2 verse 177 states that righteousness is not that you turn your face towards the east or the west, but righteousness is in one who believes in Allah, the last day, the angels, the book, and the prophets, and gives wealth in spite of love for it to relatives, orphans, the needy, the traveler, those who ask for help, and for freeing the slave. Fulfill this promise when they promise, and are patient in poverty and hardship, and during battles. Those are the ones who have been true and it is those who are the righteous. It's very important that we know that in Islam, okay, or in Islamic tradition, the idea of social welfare has been presented as one of the principal values. And I mean, service to mankind is instructed for everyone. And so, please, let's not cross our hand. If you see anybody who you think has a mental health issue, please, let's help get the needed help for the person, and let's support the person to get the help, because it's incumbent upon us to do so. Now, we know that yes, most of the mental health issues are ascribed to being associated with genes, and so mostly we go in for the rukia. We are not saying that rukia, we shouldn't do rukia, okay? However, the notion is that if you go to the hospital, you are not going to get the help that you need. Okay, and people have even said, or some imams have even prohibited those who are receiving the ruqyah from going to the hospital for treatment. I mean, some Muslim scholars have mentioned that it's very important that, and I'm sure even now, even if you come to your imam having an issue, they'll direct you, as we are doing the ruqyah. It's also important that you go to the hospital setting for those medication, because who gave the doctors or who gave the nurses or these health workers the knowledge to take care of individuals? Then we shouldn't have been taking stomach pain, diarrhea and all that to the hospital for care as well. That should have also been haram for us. So please, it's very important that we do both. So now let's come to the role of Islam in the management of psychiatric conditions. And I think from the beginning I did mention a few, that Islam provides Muslims with a lot of coping mechanisms and some instructions which, if we follow, would help our mental health and our physical health as well. And one is the Quran. And Allah states in Quran chapter 17 verse 82 that we have sent down from the Quran that which is healing and a mercy to those who believe, and it increases the zalimin nothing but loss. It's very important that we recite the Quran, and not just recitation. We need to ponder on whatever we are reciting, because in it is the healing, okay, that Allah has said here. Also, it's very important that we know as Muslims that Allah will definitely test us, right? Allah has stated that He will test us in fear, in hunger, loss of wealth, life, and fruits. But give glad tidings to those who are patient, not so. So all these risk factors that I mentioned to us, the poverty, and you see the Gaza people, okay, what sets them apart from others? Because they have the faith, okay, they have the faith that in due time relief will come, even with all the struggles that they are going through. They have even a very strong mental health than we, those who there is nothing actually going in for. And that's the resilience. That is what resilience is. In the face of all these adversity, you still hold on to the fact that yes, inshallah, things will be better, and you also strive for the best. And what's striving for the best? Making sure that you take good care of yourself, making sure that you get the necessary help, okay, for yourself. And it goes to say that, and for those who say when they are afflicted with calamity, to Allah we belong, and to Him and what is our return. Allah says that those are the ones upon whom are blessings from their Lord and mercy, and it is those who are rightly guarded. So it's very important. Anything that befalls us, we say inna lillahi wa inna ilayhi raji'un. Yes, it's actually a very strong coping mechanism that our other religious counterpart may not have. In the face of adversity, we have that patience that inshallah, things will get better. But then, if things are becoming too much, what do? We'll get back to that as well. we should know that when all these things, these calamities before us, we shouldn't despair, because what? Allah will bring what? The relief, not so. And behold, Allah says, with every hardship comes with ease. Now, let's talk about a few verses in the Quran that actually, well, it's more of preventive medicine, okay? And that's why I'm saying that Islam is a whole, how will I say it? I think I mentioned it earlier. It's a way of life. And so if we follow it, inshallah, we will be fine. Okay, Allah has given us all the things we need. Okay, and if we are to follow it, we won't have all these issues. Now, Quran chapter 2 verse 219 states that, and ask you, O Muhammad, peace be upon him, concerning alcoholic drink and gambling. Say, in them is a great sin and some benefits for men, but the sin of them is greater than their benefits. Now, we just listen to this verse. What our other counterpart would say is that when you take in alcohol, it protects your heart a bit. I mean, if you take a particular quantity, that's what research says. It helps with your heart and all that. But the Quran has already even told you that what? Yes, there are some benefits for men, right? However, okay, the sin of them is what? Is greater than its benefit. And that is why Allah has prohibited us from what? Actually even saying that you are even taking small for that, because what? You start, and it always starts like that. You are starting small. Then gradually, every day you have to be taking the alcohol. Every day in the morning you wake up, that's the first thing you drink before you even go and brush your teeth. Now it becomes a disease. Now if we are to listen to the sayings of the Prophet and the Quran, nobody will even go around doing this, right? So it's very important. Another thing is that Allah has stated that we shouldn't even come close to zina, right? La takrabu zina. The reason why I'm raising this is because pornographic addiction is real, okay? And if we stay away from these content, it doesn't even get to the point where it becomes an issue. Now, I mentioned to you that whatever you are feeding your mind would affect the way you feel, right? And the way you feel will also affect what your behavior. So if every day your behavior is, okay, I'm watching pornographic movies, or I'm watching pornographic stuff, what happens? Always you are thinking about it. Oh, let me go and take my phone. If I don't even take my phone, I feel uneasy. If I don't watch it a day, I won't be fine. So always, you start feeling that way, that let me do some, the way it's being done or what, well, let me try and all that. Then you go and what? You do it. Here the Quran is even telling us that we shouldn't even go close at all. There are certain things that Allah has prohibited for us because He knows the aftermath of them. Not so. If we take our Quran, our Hadith, our Sunnahs very well, I mean, our physical health and our mental health would be stable. And if we are to fall in all this, okay, we should know that Allah is the forgiving, right? Allah mostly forgives. And if you find yourself in those practices that are prohibited, you can always go back to Allah and ask for forgiveness, and will put in conscious effort, go for the care that is needed to come out of it. Okay, nobody is perfect. We all sin one. Nobody is a saint. And it's not as if nobody actually sins. And so if you find yourself doing it, but the whole goal is what? Not to do it. If you already find yourself in it, there is hope and you can get the help that is needed. Now, let's just look at the things that prevent us from seeking help. Okay. I've already mentioned the lack of awareness that Islam value is what's incorporated in the hospital care. Another thing that I want to talk about is the stigma. Always looking down on individuals who have mental health problems. Hey, don't touch me, you have mental health problem. If I touch you, I'll get mental health. It's a lie. Okay? We are always stigmatizing. where they were bodamo and in kasa. Okay. They are underprivileged, okay, just because they have a mental health problem. When they come to work, you see what you want to sack them from work because they have mental health problems, okay. So we have to start helping individuals who have mental health problem. And it shouldn't be such that people are scared to come out to talk about their mental health problem, because as it stands now, everybody is scared, because if I come out and tell you about my mental health problem, the next moment you are telling everybody that's what you do, and everybody starts pointing a finger. I mean, how would you feel if that was done to you? So it's very important that we stop the stigmatization, okay, so that these people will not have fear or shame to come out and say that I have a mental health problem. Just like how somebody has diarrhea and vomiting, they can come out and say, I have it, okay? And it's no fault of theirs that probably they have this mental health issue. Probably, if you had gone through what they had gone through in life, maybe yours would have even been worse. So please, let's be advocates for mental health issues. Let's provide the necessary support for these individuals. My conclusion would be that early detection of mental health is crucial. And so the reason why we are talking about mental health now is so that if you see it, the necessary help is sought for whoever has the condition. And we should know that, okay, when you come to the hospital setting and we are giving you the medication, the therapy, it's all in alignment with Deen al-Islam. It's not haram for you to come in to get those treatments. Most importantly, let's be steadfast in our Deen. Let's follow the guidance of Allah. Let's meditate. It's not just reciting the Quran just as it is. Let's ponder on what the meanings, okay? Let's follow the sayings of the prophets and all that. It helps us and help prevent us from mental health issues. If we see that somebody is beating someone because the person has a mental, you should be the one to stand up and tell the person that this is not right. You shouldn't be doing this, okay? If anybody is pointing fingers, you should be the one to tell the person that you should stop that. It could have also been you, okay? Let's be advocates for mental health issues, and let's stop the stigma against mental health. سبحانك اللهم وبحمدك أشهد أن لا إله إلا أنت أستغفرك وأتوب إليك والعصر إن الإنسان لفي خسر إلا الذين آمنوا وعملوا الصالحات وتواصوا بالحق وتواصوا بالصبر. السلام عليكم ورحمة الله وبركاته. Yes, so please, if there is any questions.
Doctor, no way fair be na ke Royal Hospital Royal so she wa ni bi ete na she wa je ke mi ni wa ke Quran ka so wa kan the Quran ni knowledge enyo hu wa susu ka di wa kan the Quran na je knowledge enyo hu e ke ni gbo yu e Quran na mi ake no fia no ni baba wo no wa ke inna lillahi wa inna ilaihi rajiun she ko gbe na ya ta o chaba the hospital na e ke ni gbo hu ke wa bi ana age wo she Arabisani will ask questions. So the first when you call women no ekemba feel fine.
Assalamu alaikum. Just want an advice from you, maybe to every concerning stigmatization. You know, usually persons with intellectual disability, there are some that physically you can see what the problem is. There are some too you may not see what the problem is, especially when it comes to Down syndrome children. There are times they are mocked at. A lot of the communities make fun of them. And I want to ask, what advice will you give to us? Because there was an instance that a boy was playing with colleagues. They are his peer mates, but they are normal. And then one hit him, and then he also took a stone and threw the stone. Unfortunately, the stone went to hit another person somewhere. And so they had to follow this boy, run after this boy, beat him up mercilessly. When the parents came to pick him, send him to the hospital, few days later, he passed. So what advice will you give to us when we see such children? How should we behave towards them? Because I think the condition is no fault of theirs. And so I want to just give us an advice, because you were talking about stigmatization. So if you can advise us on that, thank you.
Yes, otherwise I have to be writing it. Otherwise I'll someone could. Okay, so Haja, thank you very much. I think it all goes down to this education we are talking about. And for some children, I know that if we see them, we can see that these children maybe they have some conditions, okay? They are born like that. So people who probably have cerebral palsy, okay, they are sitting in wheelchair, they cannot talk, they have these spasms, okay, or what we normally call mumu, I don't know, but we see them, the children, and some of them even grow up into adulthood, right? They can't really do, some of them are able to do things for themselves and all that, okay? Or children who have what? Intellectual difficulties. That's what I'm saying, that for we Muslims, we shouldn't even have that type of behavior. It's frowned against, okay? If you see these children, what are you supposed to do? You have to advocate. And for our children, we have to educate them. And that's what I was talking about, bullying. So in our schools, this is where the mental health education comes in. This is where we tell our children growing up that it is not right for you to what? Insult children like that. It is not right for you to be what? Abusing children. It always starts from the home and in schools, not so. So our teachers and we as what? Mothers, fathers, brothers and uncles, if we see our own children what behaving in that way, we have to correct them and let them know that what you are doing is not right. And even as we have to know that these are not good and we are not supposed to do this to these what underprivileged children. It's no fault of theirs that they are born like that. And trust me, anybody can give birth to a Down syndrome child. And you see, they have special needs, and so sometimes even the parents need the support. Okay, not only Down syndrome children, but children with special needs. So it's very important that we help. Okay, and if we see something that is not right, well, so if maybe an adult was there when these children were doing that, should have prompted the children that they should stop what they are doing. Okay, so it's very important that we start with the education and then what? Cut down on the stigma and also prevent bullying in schools because they have detrimental effects.
I have 5 minutes. No, can you be question about me? Koni kema ibina ke. No 5 minutes ba hani. No. One ka wan bisa no ya bisa asem na ye no. Short na.
Assalamu alaikum.
Wa alaikum salam.
Please, there are some issues I've noticed.
Please go ahead.
Because of stigmatization, sometimes you're sitting afar. If you notice something strange about someone, and then you realize that maybe something is off, so you want to assist him or her to go for any health solution. But because you had the mindset that, oh, out of stigma, I might be tagged, say I am mad, so I will not want to even accept that I have the problem. So in such situation, what can you do to help the person? Because the person even refused to seek medical attention. He might have the mindset, say, a spiritual attack. So be going for Malam, for Wikia, it doesn't even work. They will collect money from the person and a lot of things. And the person refused to go for medical health. You have advocated, but still, what can you do to assist her?
Thank you very much. So for such individuals, number one, please, somebody helping me. Thank you.
Fine, salamu alaikum. O fine minta o ma bia ke. Be ni ewe ye beken bia be fan gbe. Okay, in ye beken you ni makola ke 14 years. She before poe ke de bibi o mi ton. The school no fiano e kayole pepepe. She shiani every blessed day. No fiano jo kaile dani ba nyefi. Nimbia ke no hu beni ehi ekpa ni no da agbi ehia ni school ehin ekpa no no ba nye e balake na kan gbelo alo eji ogbeni mi to male.
Okay, what? Okay. Yes.
Assalamu alaikum. Convulsion is aka kelaba mental hospital. Ni enyo no ona mokoye ke edwampi eke dioko be ewie. He or she will be talking on his own. No.
Salamu alaikum. Alaikum salam. Ofane like timobeno you ake keboko ye kwe wakanya gele here in this case at a hospital ni akagbeke nunkoba but care okwe a behavior onake is a Down syndrome person a bolo abnormality but beke ko ye mase bene na ni kagbeke tashi anwe ke bolo lon ne efe na kan we lon ke ye mi ahun e kele nwe bombolo kagbeke tu kele nwe tu ke jofo e kele nwe jofo agbene bene gbeke fi olon e ba bon na kan fe mo e wo mi bia ke ne kengle no how are you going to educate us based on this?
Assalamu alaikum. O fa na minta ma bia ke ye ewie momie no me ke o le seke lokwe asano wale ni keji o banyo wale ke ekule tale wo mi ke ni eni ni seke lokwo ni nku ole ihe ale ni eni kon ha le atale ewo wo ke we ba ji be kokule baba ma le ku ewo in realize ke many le previously ameke meneje seke lo ni tomo itashino ni hela fele shin e ache okot alo ne ke genius ne wo mi ke mita mabila ke ne ke many okot ke genius ne rukia e pen hi amelolo amecha
Sake I mean sake ojo e ko mo ko to lo ata e go both way.
Assalamu alaikum. Doctors, I need advice. This is about two personal issues. First of all, I have a child with epilepsy, which I also know it's part of the mental health problem. She's being consistently in hospital every month. She's always on her medication. I have a little medical background, which I know sometimes about epilepsy. When you consistently take your medication for after 6 months and you don't get the attack, you are likely to be safe. But this girl, every month, she's visiting the facility. She's taking her medication regularly, but still every time she's having an attack. Whenever she had a slight fever, then it's got the effect on her. So I need advice. I'm thinking, because we know side effects of medications and what have you. This is the second one is about myself. I mostly sleep after Isha if I'm not busy doing anything. But by 12 o'clock or 1, I will be awake and I will not sleep again. So the next morning, maybe by 9 o'clock, productive time that I should be in office, I will be sleeping. And the second one too, okay, please, okay, last one. And the last one is sometimes you are in an organization or institution, people came to meet you and you are supposed to be promoted. You've been on one promotion for a very long time. You are not getting your promotion based on one or two administrative purposes, and you are likely to develop some kind of anxiety when you are seeing people below you being pushed up, and the requirement for which you have been denied, maybe you have it and they are also having the same thing, and you are not being promoted. So what advice? Because sometimes it makes me very agitated, and sometimes I want to go off board, not to take even instructions. Thank you.
When it happens, inna lillahi wa inna ilaihi raji'un.
Thank you. So the first question.
So because of stigmatization, I don't want to admit the fact that I have a problem.
Okay, so I think she was making reference to maybe a colleague or somebody else that the person has seen that probably the person has a mental health issue, how the person should approach it, because I mean people see mental health issues as being because of the stigma, people do not come to the hospital. So firstly, okay, if it's somebody you are working with, I don't know the kind of rapport you have with that person, but you have to be kind and you have to be careful the words you actually use. So for such individuals, you may have to approach the person in a nice way. And I mean, if you have that rapport with the person, you can go on and tell the person that, oh, I've noticed you, this is how you've always been, but for some days now, this is what I have observed about you. You'd be surprised that just coming out to, I mean, the concern and ask the person about these problems, the person may even open up to you and tell you what they are actually going through. Because sometimes in our daily life, you just want to talk to somebody and just tell somebody how you are feeling. Alone, it's almost like medicine for you actually, and that is what our clinical psychologists do. When you come, they talk to you and help you in certain ways, or what you should do to help you in certain ways. So you can go through the person, and then the person opens up that probably this is the challenges that I am going through. Then if you think the person, I mean, from the conversation, you can suggest to the person that, oh, I know somebody who went through the same thing, went to the hospital and got the necessary help that the person had. Okay. If you cannot go and tell the person, okay, sometimes maybe you may have to get somebody who is close to the person, okay, who has also noticed some of these things about the person, and let that person rather go and engage whoever is having the problem. Or family, okay, if you know the person's family, okay, you can kindly tell the person that, oh, I've noticed this and this about your person. Have you also noticed it? And I think that the person can get help. However, sometimes you may have approached, family would have approached, there's something wrong, but the person is refusing help. So what we normally do is that, yes, sometimes it's a bit challenging, but when you come to our hospital facility, especially for individuals who are a bit agitated, aggressive and all that, we have community mental health team who could come assess the person at home, and then we may help the person come to the hospital by maybe sedation or something. The person comes, person is admitted for some days. After some time, you realize that the person comes back, okay, and then is able to go and complete the treatment. So these are some of the options that are available. You can approach the person, you can let someone else approach, you can approach family, okay, and then if all that is not helping out, do the other thing. Another thing was that, let me give a scenario. There was someone who was using substance at their workplace, and it was affecting the person's work. So they had to give the person an ultimatum that if you do not go and seek help, then that will mean that we have it's a threat, but I mean in a good way to help the person go for the treatment that the person needs. I hope I've answered your question. Please, the next.
So I have a child who is okay academically, so at school is fine, but is forgetful at home. What could be the issue?
Okay. if the child is fine at school, is interacting well at school, okay, doing well, interact in class, school, teacher is not saying any problem, but immediately the child comes home, the child is forgetful, the child is not able to concentrate, then probably there's something at home that is triggering this particular behavior. Could it be that at home, there is too much strictness, or every small thing they are beating the child? I don't know how old the child is, okay? Or maybe there's something, is there any form of abuse or neglect at home, okay? You have to look at the surroundings. And sometimes you see children, we think that we know. So you won't sit the child down and ask the child that, why is everything okay? Because children would explain, even children, adults, adolescents, okay, sit them down. If you see something unusual, that's what we fail to do. The children, adolescents, they should be our best friends, such that whatever happens in school, when they come home, mommy, when I went to school, this and this and this is what happened, though, such that they are telling you everything. Make sure you sit that child down, talk to the child, and see if there are any issues that probably child is not able to tell you, or there's something that is worrying the child. Talk to the child. You may find solutions to that problem from that. We always think that we know what is best for our children, but please, let's listen to our children. I tell you, the children, okay, very young children, when they come, they are seeing certain things. Please, let's not take them for granted. Listen, probe further, ask in a jovial and a nice way. Don't make the environment hostile such that your own children can come and tell you what is happening in school, okay, what is happening in their life, or who is telling them that they should try red or try shisha and things. Okay, so it's very important that we build that rapport. And let's find out, probably there's something that is going on that you probably don't know, that is precipitating all these things.
So if my child suffers convulsion, do I bring the child straight to the psychiatric hospital, or I can go to a general hospital?
No, so for seizure, if a child develops seizures, you can go to any health facility. You'd be taken care of. If you go there and they need to refer you to see, so mostly for children who have convulsion, it's a pediatrician, the doctor that looks after younger children, that actually manage. But sometimes, aside those seizures, they may have some behavioral problem, and so they'll refer to us to help in the management. So when they come, then we continue with the seizure management, okay, and then maybe the behavioral aspect of it. But if a child has convulsion, let's not sit down. Let's take the child, because the more the child is having the convulsion, the more it's affecting the brain. It can affect the child's memory, it can affect the child's intellect, and it can affect how the child can actually even do things for themselves. So it's very important that we take notes of that.
So someone is walking on the street and thinking to himself, but he's talking whilst he's walking. Could that be a sign of anything?
Okay, so yes, it may happen. Sometimes you are absent-minded, such that you've been calculating so much. Okay, maybe you want to do this. Okay, you want to achieve this, like our brother said earlier. So, like I'm saying, once in a while, if it happens, then you are talking to yourself. It's not unusual. We all do it sometimes. But then, and before we can say you have a particular mental health issue, you should have a combination of symptoms before we give you a diagnosis. It's not just one symptom. So aside that, maybe the person is just talking to himself. Maybe it's a person hearing voices when nobody is there. It's a person seeing things only them see, others do not see. Okay, it's a person withdrawn, always crying. Okay, feeling sad and all. So it's not just about it. But then, if you start thinking that, if that starts happening to you, you have to be careful. You have to try and calm yourself. You have to do the things that would help you de-stress, because it's stress. You're building stress up. So what do? Healthy living activities, balanced diet, some exercise, sometimes walking. You and your husband in the night or in the evening, hold each other's hand and walk around. Okay, if you don't want to hold each other's hand, but just walk around and have a conversation, or just come outside and sit down with your chair and just catch up. in this technological age, everybody is holding a phone and is typing and is watching TikTok and Instagram, and we are forgetting the words, the human interactions, which are my days when I was a bit younger. We would sit around the maize when we go and pluck the maize from the farm. We would sit around as family and be saying stories and what, be peeling the corn and all those things. I mean, technological or now, those things are no more there again. But as a family, okay, let's find those fine things that we take for granted, but they are very important, okay, and it helps in the mental well-being of us all.
So I took my child to the hospital, and there was a child with Down syndrome. So occasionally the child will be jumping up and down and shouting. Now he said these people, we should treat them well, but my child is also looking and copying and doing whatever the person is doing.
Okay. So children naturally would imitate other children or imitate things. Okay. So I don't think that's a problem. Okay. Maybe outside the setting, if the child keeps on doing that and other unusual behaviors, then it's a concern. But I mean, if the child is copying what another child is doing, it's not a mental health issue. And this goes to show that whatever we are doing, our children are copying. So if you are drinking alcohol, you are smoking, your children are learning. If you are doing other things that are prohibited and not right, your children are. So why is it that sometimes when adults are having conversation, then your child will come and say something? Because what they are listening to, whatever you are saying, your mannerisms, okay, your mood, the way you solve issues, okay. If you are angry, how you react, your children are watching you and they are mimicking all that. So you think that maybe your child is misbehaving. Sometimes it's your behavior and things that you do that they are copying and mirroring it. So it's very important that we take note of that. Thank you.
So that this mentally challenged person I help. So occasionally I give him something to cover himself, but he removes and throws it away. People said that his condition was because he practiced some occultic activities. Now, this kind of condition, is it treated by you or he has to undergo rukia?
So the thing is that if you observe this unusual behavior where individuals are removing their clothes, wanting to walk naked and all that, yes, the person needs an assessment, okay? And as I said, it's a constellation of symptoms that would actually use to diagnose. So maybe the removing of the cloth and things, maybe as a result of something else, and it could be as a result of maybe substance use, it could be out of maybe the conditions I remember, schizophrenia, it could also just be anxiety or anything. So for such individual, like I said, if you liaise with their family, they may need some assessment. So person can come to the health facility where you can be assessed, and if there's a needed medication, would be given to the person. I'm not saying that rukia we shouldn't do. You can do the rukia whilst we add on with the medical aspect as well, so that you have both, right? The chronic recital and the medication and the therapy to get the holistic management.
So I have an epileptic child. He's taking the medication but has to go to hospital monthly. Any advice that you can?
Yes, so one thing we should know about epilepsy is that there are a lot of things that may be causing them. So for such children, yes, it's true that sometimes they may be on the medication and still be having the attacks. Number one, it could be that the medication has not been maximized. Okay, so maybe for example, the medicine, okay, if a child has malaria and an adult has malaria, okay, the dose I'll give a child is different from the dose I'll give an adult, right? And same thing for men and women, the dosing may be different. So maybe for your child, maybe we haven't hit the limit where the treatment is enough to take care of the seizure, okay? Because we have the minimum dose and we have the maximum dose. So we start gradually. We start giving you maybe one tablet, if we see that, okay, now you are taking one tablet and now before, let's say before you started the medicine, you are having it like 5 times a day. Then when we start giving you the medicine, now it has come to about 2 times a day. Okay, now we will increase the dose again. Okay, and maybe in so doing, we help you with the symptoms to the point that the person is not having the symptoms again. Sometimes treating of the epilepsy may be a bit complex, such that you have to add other medications to it. Other things is that maybe we may have to investigate as to what may be causing it again. Maybe there could be something in the brain. So mostly when you come, we will ask you to do some labs, do a brain scan, so that if there's something going on in the brain that may be precipitating or causing the seizures, the necessary help is given you. So those are the things that I can, explain to. Probably that is why this child is having this constant seizures.
So I'll combine the last two. I sleep early after Isha and I'm awake by 1 a.m. and I cannot sleep again. Then in the morning around 9 a.m. when I'm supposed to be productive, I'm feeling sleepy. And then I've been on a job for a while and I've been promoted only once, so I get agitated. Any advice that?
Thanks for the question. So with regards to the sleep, I don't know how your sleep was probably before this. So normally would say that what is your usual? So in usual cases, there are some people who probably sleep at 10 and then maybe wake up at dawn, maybe 4 o'clock or maybe 3. They would have how many hours of sleep? Maybe it's more than 6 hours of sleep. There are some people that may do less than that. And remember that the more you are aging, you won't get the sleep like how you used to. Okay, and there are some people that their sleep is minimum but they are very productive. If maybe in the past you are sleeping more and then suddenly now you sleep and wake up and you are not able to sleep again, what do you do during the daytime? Because if during the daytime you are whiling away time, you are not active, you probably not being, mostly you are active during the day, doing everything. In the evening when you can, definitely you would have slept. Another thing is that sometimes if you're working at 9 shifts, sometimes what can happen is that your circadian clock or your rhythm could change. So if probably before you were a day worker and now you go and then you are working at night, that means what? Your shift has changed. All these things can be a reason why. There are a lot of things that may be the reason why you are able to sleep for such a short period of time. And so maybe you need to talk to someone so that we see how best it is, if truly it's actually an issue for you. But in all this, is it affecting? Okay, you said that instead of working, you are actually sleeping. That means it's actually affecting your work. But before we can say anything, we'd have to delve deeper, ask you more questions and see probably where the issue is. Another thing we know is sleep hygiene. So before you are sleeping, there are certain things that you are supposed to do that would help you sleep. You don't eat fufu and groundnut soup, then 2 minutes you go and lie down, you are coming to sleep. No, you may not affect your sleep, right? You're going to sleep at places where it's very noisy. Definitely you won't have the quality sleep that you have. The place is not dark. So the circadian clock, the pineal gland, it's actually when it's night, okay, that's when you actually sleep, right? But if the clock is not working well, and that's where the challenge is. So if you're going to sleep and there's light on and all that, your brain may be telling you that it's day, so you don't need to sleep. But you put off the light, it tells your brain that, oh, it's time for bed. So what? It helps, melatonin is released, and you are able to sleep. That's some hormones are released to help you with your sleep. So when we talk about even sleep, can be a topic on its own that we'll delve in to talk deeply about. Okay, there are a lot of things that go into it. And yes, if you're having sleep issues and it's not as a sort of medical condition, okay, so the other thing is if you have a medical condition that probably may be affecting your sleep and all those things, yes, we have some medical conditions that may be precipitating or causing that as well. And sometimes medications that we are taking can also predispose you to these kind of sleep issues. So there are a whole lot of things that can cause you not to sleep. And that is why if it's a problem for you, it's affecting your daily life, your work, your productivity, you need to be checked. You come, we do a thorough. So all these things, we'll ask you questions, we'll ask questions, we'll do tests, we'll do labs. Okay. Then we see where the problem is. Then if there's a need for us to give you medicine, then we'll give you. And then about the promotion. So you said that there are some requirements before promotion. Is it that you haven't met it? If you've met it, you can approach your manager to understand why is it that I have gotten to this and I am not getting the promotion. Because yes, it's due you, it's rightly due you. After every particular maybe year, every work is different. You have to be promoted by. So why am I not being promoted? I think that would be maybe a starting point. You have to know what the issue is and why they are not promoting you. Okay. Then afterwards, depending on whatever the issue is, maybe you may have to weigh your options. Are there other options that are better than the options they are giving you and all that? So and that's a little that I would have to say. But you really need to confront, ask, so that you know what the issues are. So that if you need to better yourself, maybe you don't have the certificates or you don't have the requirement, you go get it and then maybe that would help. So you need to communicate and find out what the issues are so that you can work on it. Thank you. Hope I've been able to answer all the questions.
Assalamu alaikum. We thank our wanda mami eshiwa den when I born you before my week so wanda mami eshiwa ake ikewo eba gbasani. In fact, from the way ni eyo, it looks like we have a lot of work ahead of us. So from time to time we invite her to come and take a particular topic and treat it. For instance, sleep issues come. In fact, no, madam, we thank you so much for taking time out your busy schedule to be with us. May Allah bless you and your family. Say hello to that for us. Eid Beshe ni kajumu asmo obaya Eid. She asanona some he kaimo ke hawo Eid be no wa me quick obagba isani be fio keke won pa fa nya wota shi ni wo butwe bona fe ni wa do fe wole yo mi ni wo yo be mi o e first 10 days mi ni akewo ni bi ni ke o fe e ba wa wo no wo sta mo ni wo boni e to kura no sta utashi ne fe agba wo du ma le ba mi awo wo papa wa tele ko ni ba ni e ko wa ba ni abayi.
السلام عليكم ورحمة الله وبركاته. بسم الله الرحمن الرحيم وبه نستعين وبعد. In Uganda, and my Uganda, I can be a fire. Can clear on what should I play on her low on Bejomo how he near about Muhammad sallallahu alaihi wasallam. Take boni achon here we wabana keshin we kenkle nyoma ni jizul hijja nyomle le kejizul hijja nyone ifata nyoji ejweni Allah subhanahu wa ta'ala fi amekron yenyoji ekome nyoma ke enyo amne le kejizul hijja nyone Allah subhanahu wa ta'ala eke kenkle nyoma eke kakita يا قرآن من كو سورة الفجر الله سبحانه وتعالى إك بعد أعوذ بالله السميع العليم من الشيطان الرجيم بسم الله الرحمن الرحيم والفجر وليال عشر والشفع والوتر الله سبحانه وتعالى إك فجر جتشل مكاكتا ni wanile loe keshi neke jechele monene Allah ke katkitaji jechele moneje echele niji idi bile on the 10th of Zulhijjah na baya ide na kamanke na kan jechele moneji nani Allah subhanahu wa ta'ala ke kakita neke jechele mone miye nibi babao jenone afio neke jechele mone miye niji na kan bile jigbina atwate shetani te na kan gbile jigbini meje ihram na meje meite meichwe na kan gbile ji beni afo kulu meni ame fi haji tamattuka kirane namba foto na kan gbile huwa meni wo fi ku haji wo foto ni na kan gbile asmoni me afi tawafulo ifada wo ni chimo wuji ejejina ni ya na kegbine neke gbene je chele mo Allah subhanahu wa ta'ala ke kankita neke beke nyongma kankita walayalin ashir neke beke nyongma ne ni lelo ke lo ji kankne gbi nyongma ni yo dhul hijja min eje shin se sho mene gbene je gbene ji enumo ye neke gbi nyongma ni Allah subhanahu wa ta'ala ke kankita me ni ke won ya hie gbene ji suwe e ba fi arafa gbi ne ke arafa gbene huwe Allah ke kankita ike wal water ni biye no jigbe ni ji ninth gbene ji ne hu ye zul hijja nyoneme wa shafi'i ka ke shafi'i even number biye na huwe ni le ke shi gbene ji yawm an-nahr binake fo kolo ase ni ji 10th of zul hijja no ji shafi'i ni witre no ji mene no ji arafa wone ke bi ne stroti yene ke bi nyongmane mi alaw ke ikakakita ni baro sallallahu alaihi wasallam ya hadith mi ke ma min ayamin al-amal as-salih fiha ahabbu ila Allah min hadhihi al-ayyam yani ayyam al-ashr fi dhul-hijja bi kume beni ne ke bi ne Allah subhanahu wa ta'ala ba chunu chuma ikpakpa yemrin inna ke bi ne Allah sumo fi ne ke bi nyoma yazal hijjanen ne yena ka sahaba ka wala jihad fi sabilillah baloke wala jihad fi sabilillah illa rajulan kharaja min bi nafsihi wa malihi thumma lam yarji min dhalika bi shay'in jihad fi sabilillah mubayani wa chate Allah subhanahu wa ta'ala ibeno nekani chuma jinu chuma wulu wa sahaba men susu ake wo nekani chuma ne den cheke mo chue ndololo e mo ni ba chunu chuma papa ko ye neken nyo egbi nyon mane mi mo ne te nyumo gbe ndololo e enu chuma she na kan ni gbalo ke ni gbe she na kan ke she na kan illa rajulan خرج بنفسه وماله ثم لم يرجع من ذلك بشيء بجموني اشيانه تلنيموغبه كل دنچه ولا كل دنچه نينامو نينك ولا نينكتي كنينامو نيكتي اكه كوكرا كويسكبا داني نك موني با شم موني با چنو چمو پاپا ينك بي نيوما نيملي ejira ho ke muslims ko me ni ne ke gbe nyuma na epo na agbeto ni me ameni ne ke gbe nyuma na ne nyuma ke kan kita ejigbe ni gbara sallallahu alaihi wasallam hadith me kenklen na ho ke hioma wo ke jo banyo ke hima ke onyo ke hima gbe no banyo ke hima emi obanyo fi ke kura le gbe ko meni je arafa gbe ne ke hima ne ke gbe ne no jigbe ni ji so ni bane ni je arafa gbe bomode no ke hima menete ame afi haji aka me ka hima na kan gbile mini ho ake na kan gbile jigbi ni ji doa gbi e wo keja me hima ne kule saudi bonin hunu na chuo ke ni bi ne kule mo enan he wale ne ke fi doa ni na kan gbile ji doa gbi wa ke meni afi haji ama me ka hima shi min ke bonu afi ko haji no yoshia ake wo hima yeneke ma hile nese neke gbine ji doa gbi modi ba hima yeneke gbine ni ji su ni bane ni ba hima ake yukafir sanatayn sanatul madiya wa sanatul baqiya modi ba hima yeneke gbine no aba hade aba nwe shine fi afine huwe ka afine yehi shiwono wale ake neke shine na cho no ji sogair kebair ni ji sha wije Allah ke wo beje wa fi tauba kenda ke wa isha bibi ba ke wo isha afine hu ke afine yo hie jengma hile gbi ko beto mi mini ba chinna ile he wo won chenye me fa to ese wo bomodi ake shi ne ke gbi ne ke kurale arafa gbi le o ba hima ya arafa gbi le ke jigbi ni ji doa gbi ke khairu doa dua yawm al-arafa dua ni jidwa ni ehifefe jidwa na fi arafa gbile ine ho ne ke arafa gbile ne menete ya fi hajje am zuhur ke asra am chana am sfiyo zuhur biami bona fe ke je zuhur an kata biami no hunu ba nyoshe na me ke fi dua wo min ke bonu ya hajje wo bomodin between asr ka maghribe jibe ni ke fi dua mustajaba ye wo bomodi yake shi neke sona ni ba yang ma hile no ba hie se wo teme ni wo hin ma ke me ni ba hin ma fe wo ko ake shi o asr ka magrib tele ihe hiya mo ni bi fa inke mbang ko ba jele Allah ko ba jele Allah subhanahu wa ta'ala hi be fon se ko no fi ano no bomodi yake ona dika no fe doa waye nibi na gba isrote ekume wo blanchi nemi ekume wo kuman ekume wo biahe ekume wo nichumo isanje kenibi sanje le fa baba o nibi ni hehia wo fa wo hanine ke gbine ni bane efegbi ni wo ba fu wo ba che Allah subhanahu wa ta'ala Allahu ayyabo kejine ke arafa gbine ba inno jechem le moji idi gbine jigbi wolo mo fiamo ni nyuma drole ake ba fukulu se ebomode ne fuye Allahu yo ake mo ne fe ni atake fukulu ye neke idi ne keji kenkne gbi zul hijja she e ka je twa ku ye he e ka je wana kata gbeni e ba fu ekolo ese ko ye mi ahun lo fe ko yin to ni meno na ke begbele ni mafi neke afolisha ne na kan gbele no pa nekani bi na fe mo kata bia me ni obafo okolo kolo no obafo esmanye me won fo kolo bona fe no ngoshida ke ha Allah won fo kolo ni isa kolo ni kejo na boden chochi ba to umlen ni na mo no ko ba fo ne ke kolo ne alo ko ba he kolo ne Allah ni ke hawo ni bi fe krokro me fe no ya Allah no ni wajo ma mi musun kuto kumlin ke ba wo ke no ko ba no fiana no na Allah ni hawo wo ke won ji no ba fi ya Allah wo ji ke twi jino ni ko fe hu ye nyi mo hewo me na ehia he ko ni ke mo hie ko lo ni ehie ko lo ni ba fu e ba sha ko lo amfoni ne ba gbe hwe social media fe ni mo fi amo ana ko lo ni ba fu ya hanu insha Allah subhanahu wa ta'ala bi ni hanu wona wala ke Allah we tawo lo ni tawo la ni ba hwehwe shino ni Allah subhanahu wa ta'ala tawo ye ne ka for the shanem nenji wo nyumma be shima ene shino ni Allah subhanahu wa ta'ala tawo ene he wo fi no fi ano nyumma wo keji na kan gbele she ko lo e pako akan yi je kolo ni taflache ehime ko me onwe kolo ni taflache enale ko me onwe kolo ni taflache ekole akronu ne ekun alo eto ne echeyehe alo kejo na kolo na fanga kene ke kolo ne behwale alo kolo ne gbo ni ewi fe bi ale hejo je ne ke kolo ijino ni kolo ne yiseke kolo ne shura ne ke kolo ne fe akefe mini akefe la ya nyahan wo ke kolo ni hiche afela ya kejo ye hewale be china be afukpongo okome to ba nyo be afukpongo shake kenye be hewale nye ye kome 7 nye bua nyina woku ye kome 7 nye bua nyina nye hi achina alo afukpongo nye fi shikejo gbo ko o woku e to alo abotia ke 1 year shele ya to ke 6 months ke ma 1 year shele ya shichina 2 years keya afukpongo 5 years keya ene ke wo ke fiye wo fiye Allah subhanahu wa ta'ala hiyo ke wo fiye wo jawi lo emiete ekome wonon ekome wo kwa hiafo meni beko dani no ne hwe wo baja na kanono wo baja wo banyo ja ke ha Christopher ke mekro mo meni wo ka me chuoni nke ni bi wo banyo ja wo ha me ke osmopoe lo ekeje ofie ke osmopo banyo ke fe aja ene hiwo nigbe egbele naka onaka otabia mu shemeko e manse e ka me shika ke ni bi fe ameka ka heto na ka jaha ko ni na kanto amayi ku yemi ya ke Islam egben naka naka homo ne foto ne na ka woku da me ne ba fidi ameda ene wo keke je ku hame ko me poden je efi enye efi akeke je ko ni ke hai woku me ni fi ne no hu tomo behi shika ga ke na abo owoku e shekwa amepo wo hiafo ele eya ne agbo bomode no halefi o no ni achooji no Allahu ayyabo beni jiten fe won ya idi bile ake wojie nyimoye atade ni he few alo atade ni yo few yo atade fe amne no ji wo idi atade kaka ke do isaga ma wo atade hi o atade fe no ni hi eche fe no ji wo idi atade wo na ka atade wojie nyimoye wo ya idi ground na fila ko be dana ba so le ni ka so le agbena hu na fila be ikama ko be no njike imam ba aba so ni Solomon aba so le raka kenkle Fatiha kenkle raka imam keke Allahu akbar noni ke waboti Solomon na kan Allahu akbar takbiratul ula alo takbiratul ihram noji noni ke waboti Solomon ni nwele otini no sene ba fe takbirat 7 6 eko me ke 7 eko fe ko e botiam shibbe fe baba we wo fe 6 ye na kan fe takbira se na kan fe takbira ka ke Allahu akbar imam wa ke dua na ke bilio سبحانك اللهم وبحمدك وتبارك اسمك وتعالى جدك ولا اله غيرك نو باك دال سمي امام باك الله اكبر الله اكبر شك اقبع كما فتح اك فاتحه اك سوره ات ركوع ات سجود اك ات شيكو اشتي مي اك الله اكبر اك كدمش اك 5 هو ابا كيك بنك حسلما kale no ye bia me no ba imam eje nshiomo he no ba ni na le kole last takbire ni ba fe da ni ba bon kira afi mo nyemo ese no fe na kan takbire shi bo takbir no ba fe yi takbiratu ula okay Allahu akbar no no keno se ni imam e fi Allahu akbar egbe na ka ke imam e shi we wo bia me ni kale e sura be bo fe o Allahu akbar Allah dabi na ka Allahu akbar e fe mi ni ehumo iwo boy mi enyemo ese ka le no ni bia me no ba imam e fe ruku mo e boy bia me no sheje no Allahu akbar takbiratu ula e ka onye ese ke boti ruku emi ka ke an ma be in 5 alo ese be no ba gbe na e fe mi ni enwo ehe no e wo ka fe na ka le no ni be no ba imam e be first rakana e ya second raka mi no ba if I know banana le ne domoshie fe mo first takbire no nyese ke takbire kwa ko ba jenshie ke na afi ke te ahun ni efe ni no problem but first raka na ho here no ji imam second raka shibwe o mini o first raka jino wa ke ene jo first raka ka gbena ni imam hasalama ko gbe oteshin me raka ba fi second ni second ta fi ole tin ko teshin no ka na kwere ala kwere enyo ko baba 5 ugbena Allah wa ha oshishin mu won ke jibo ni o ba sole ke ale no imam ni ke o ba sole ni fe takbir ke takbir Allahu akbar eyin pa no ni ke 5 alo 6 ni ba se ni bo in Fatiha ke mo na kan no ba ya ibela ke eshi no ko wo ba fe mi ni sujudu ko dabi ehu Allah wa ha oshishin mu ne ke no ibutiomi keji wo bana asole salatul janaiza ni bia me no ba imam e fe takbir kenkele omo e ko le ye no ni ji enyom ni e bo keji o ba no ba fe kenkele no ji bo mi ni o kenkele wo bia me ni imam en fe sollu ke hagbalo bo ba fe mi ni wa fe Fatiha kete no ni ji eteni ke Allahu akbar na kan bia me ni fe dua ke hagbonyu e ba bo fe mi ni sallu ala nabi kete nani jeje ne fe ke ha me fe ke bon wo fe do ha me ni donye ke ha sallama alaikum ha sallama ke bon wo fe do adano ba fe me ni wa ha sallama Allah wa ha wa shishinu be pie wo ka ba no ke wo ba ne ko me pona ke sallama ke wa assalamu alaikum dabi e wo no ne shibwe o ka ba fe me ni no ni bo ba kenklen no ji o me ni o kenklen bana ke koko wo bana ke fe ebotemi pepepe wo keje obani imam last takbire Allahu akbar bo first wajino wo ke hasalama ke bo fi Allahu akbar ko nojo meni o second e ko ke meni sallu eba e ko fi third one e ko fi do ha bonyu e ko fi fourth one e ke meni fi sallama ni wa o shishinu na kan bia me ko la wo gbonyu e sigbo bo do mo shi o fe meni o complete o salamo Allahu ana omobo hen wali le tashi Allahu ngoke wo wonya mefe na meti ame afi haja afi ne nyuma ha ame haja ha wote me no fe ko haja ko da nyuma ha na afi wasa afi be ne wo fe wo fata me ne nke la beika he ame enye bualo wa wote me ni hu wo fi haja ko moe Allahu abu wo haja ya ha wo ballahu subhanahu wa ta'ala ni ina wo fe mo bo wo gbo hin fe musin se nyuma na me mo bo wo me hunu yo wala mi Allahu anu wona gafe na papa ballahu subhanahu wa ta'ala nde yana na wa fi nyuma fi le me da ha wo wo tuishi ni nyuma ai ha wo ballahu subhanahu wa ta'ala arafa gbile nyuma ha ni ba ni na wo wo dua fe ni o shome Allahu le fe o mo Allahu afi fe ha wo dani be ashe ballahu subhanahu wa ta'ala ni ina mo bo hini wali le tashiye ya wawe mu ame nyi wa anga oke o hini woke lo jigwa Allahu ai ha wo wassalamu alaikum wa rahmatullah.
Assalamu alaikum. We thank our Imam. In fact, we have been enlightened. Certain areas that we confess, I fell short. So now I've learned something. And I believe most of us have also learned something. May Allah add to our knowledge and his knowledge. Our Imam was in Parliament last Friday to treat similar issue. So, Ghana Muslim, we are going far. So, we say, Imam, thank you very much. And we thank Allah for Ghana Muslim Mission. Fisabilillah.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين الرحمن الرحيم مالك يوم الدين إياك نعبد وإياك نستعين اهدنا الصراط المستقيم صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين آمين. بسم الله الرحمن الرحيم ألف لام ميم ذلك الكتاب لا ريب فيه هدى للمتقين الذين يؤمنون بالغيب ويقيمون الصلاة ومما رزقناهم ينفقون والذين يؤمنون بما أنزل إليك وما أنزل من قبلك وبالآخرة هم يوقنون أولئك على هدى من ربهم وأولئك هم المفلحون إن الذين كفروا سواء عليهم أأنذرتهم أم لم تنذرهم لا يؤمنون ختم الله على قلوبهم وعلى سمعهم وعلى أبصارهم غشاوة ولهم عذاب عظيم ومن الناس من يقول آمنا بالله وباليوم الآخر وما هم بمؤمنين يخادعون الله والذين آمنوا وما يخدعون إلا أنفسهم وما يشعرون في قلوبهم مرض فزادهم الله مرضا ولهم عذاب أليم بما كانوا يكذبون وإذا قيل لهم لا تفسدوا في الأرض قالوا إنما نحن مصلحون ألا إنهم هم المفسدون ولكن لا يشعرون وإذا قيل لهم آمنوا كما آمن الناس قالوا أنؤمن كما آمن السفهاء ألا إنهم هم السفهاء ولكن لا يعلمون وإذا لقوا الذين آمنوا قالوا آمنا وإذا خلوا إلى شياطينهم قالوا إنا معكم إنما نحن مستهزئون الله يستهزئ بهم ويمدهم في طغيانهم يعمهون أولئك الذين اشتروا الضلالة بالهدى فما ربحت تجارتهم وما كانوا معتدين مثلهم كمثل الذي استوكد نارا فلما أضاءت ما حوله ذهب الله بنورهم وتركهم في ظلمات لا يبصرون صم بكم عمي فهم لا يرجعون كصيب من السماء فيه ظلمات ورعد وبرق يجعلون أصابعهم في آذانهم من الصواحك عذر الموت والله محيط بالكافرين يكاد البرق يخطف أبصارهم كلما أضاء لهم مشوا فيه وإذا أظلم عليهم قاموا ولو شاء الله لذهب بسمعهم وأبصارهم إن الله على كل شيء قدير يا أيها الناس اعبدوا ربكم الذي خلقكم والذين من قبلكم لعلكم تتقون الذي جعل لكم الأرض فراشا والسماء بناء وأنزل من السماء ماء فأخرج به من الثمرات رزقا لكم فلا تجعلوا لله أندادا وأنتم تعلمون وإن كنتم في ريب مما نزلنا على عبدنا فأتوا بسورة من مثله وادعوا شهداءكم من دون الله إن كنتم صادقين فإن لم تفعلوا ولن تفعلوا فاتقوا النار التي وقودها الناس والحجارة أعدت للكافرين وبشر الذين آمنوا وعملوا الصالحات أن لهم جنات أن لهم جنات تجري من تحتها الأنهار كلما رزقوا منها من ثمرة رزقا قالوا هذا الذي رزقنا من قبل وأتوا به متشابها ولهم فيها أزواج مطهرة وهم فيها خالدون إن الله لا يستحيي أن يضرب مثلا ما بعودة فما فوقها فأما الذين آمنوا فيعلمون أنه الحق من ربهم وأما الذين كفروا فيقولون ماذا أراد الله بهذا مثلا يضل به كثيرا ويهدي به كثيرا وما يضل به إلا الفاسقين الذين ينقضون عهد الله من بعد ميثاقه ويقطعون ما أمر الله به أن يوصل ويفسدون في الأرض أولئك هم الخاسرون كيف تكفرون بالله وكنتم أمواتا فأحياكم ثم يميت كيف
أعوذ بالله السميع العليم تكفرون بالله وكنتم أمواتا فأحياكم ثم يميتكم ثم يحييكم ثم إليه ترجعون هو الذي خلق لكم ما في الأرض جميعا ثم استوى إلى السماء فسواهن 7 سماوات وهو بكل شيء عليم وإذ قال ربك للملائكة إني جائل في الأرض خليفة قالوا أتجعل فيها من يفسد فيها ويسفك الدماء ونحن نسبح بحمدك ونقدس لك قال إني أعلم ما لا تعلمون وعلم آدم الأسماء كلها ثم عرضهم على الملائكة فقال أنبئوني بأسماء هؤلاء إن كنتم صادقين صدق الله العظيم
Takbir. Numo ana obobo. Numo ana obobo. Numo aka oricho faithful. Numo ahewa solemo. Ke ake Islam a universal religion. It's a way of life. Whatever situation you find yourself, Islam will make a way for you. Akawokala block. She ona no happy mede. What can the Quran? Numo ana obobo. Wọ́n intention ní òkú ẹ̀fí fẹsẹ̀ bí láì kẹ̀mẹ̀ fẹ́ mẹ́ni no ko ngba ona ye he come on me ke ni de fe ni wo ana obobo ni emo wo sole mi awo wo chemene cho here kete